Hello?
Hi, doctor, we can hear you.
Can you see?
No, we can't see you or the presentation.
Hello?
Hello?
Do you listen to me?
Yeah, we can hear you, doctor.
Can
Can you
see
share?
me?
No, we can't see you. Can you turn on your camera?
Yeah, but I don't know. Oh, yeah. Sorry.
We can see you, doctor.
Okay, thank you very much. Good afternoon. I'm Vladimir Sanchez, and I'm dermatologist, and I live in Santi Spiritus, Cuba. I'm going to present the work liquid nitrogen in the treatment of patients with alopecia areata of the scalp. Please, one moment, please. Okay. Okay. Liquid nitrogen in the treatment of the patient with alopecia areata of the scalp. Alopecia areata is a common autoimmune disease that targets hair follicle. It's the most prevalent of scary hair loss disease, and it can have an influence on the quality of life of the patient with an impact on their functional capacity and on the world of work and society. Alopecia areata sometimes occur in patients with atopic dermatitis, thyroid disease, lupus erythematosus, and other autoimmune disease. Present with single to multiple patches with well-demarked borders, and sometimes progressing to complete scalp hair loss, or to total body hair loss. And alopecia ofiacis is a subtype that is often difficult to treat. Also, not life-treating cause psychological effect in patients, including anxiety, depressed, and thus is a serious clinical concern. Genetic and immunological factors, including T lymphocytes and cytokine, plays a crucial role in the pathogenesis. Perivulval lymphocytes infiltrates is an expected histological feature of alopecia areata, and it is representative of activated T lymphocyte. Pathogenesis remains controversial, which result in non-specific and unsatisfactory treatment strategy. Many treatment options, such as a topical, intralesional, systemic, and phototherapy, are available. For example, steroid, finasteride, minoxidil, platelet plasma, tacrolimus, calcipotriol, and liquid nitrogen. Liquid nitrogen in alopecia areata of the scalp produce vasoconstriction, and the local vasodilatation during time causes the scalp massage. The vessel blood around the hair follicle are dilated with increased blood flow that leads to hair regrowth in the follicle and influence as an immunomodulatory against agents T lymphocytes that cause damage in the disease. The objectives of this work to describe the result of the application of chemotherapy with liquid nitrogen in patients with alopecia areata of the scalp. A descriptive and longitudinal observational study was carried out in the central area of Sancti Spiritus City from January of 2018 to February of 2021. The sample was made up of 32 patients who meet the inclusion criteria: location of alopecia areata in the scalp, and acceptance of being included in the study. The initial evaluation included clinical, dermography, date, physical examination, dermoscopy, and photography. The therapeutic intervention was in the dermatology consultation of the polyclinic with the application of a liquid nitrogen with cryotherapy, with cryospray twice a week until completed 12 applications. The final evaluation was carried out at 20 weeks of treatment with the same parameters of the initial evaluation. The main responses variable was the patient repopulation and the presence of the adverse events. Okay, you can see the patient classification according to clinical and social demographic variable. The most affected was female with 20 patients. The mean age was between 23.5, and the clinical form is most frequently the multifocal alopecia areata, 56.2%. The association with other disease, only 5 patients, and the patient had dermatitis, atopic dermatitis, and thyroid disease. And the previous treatment only in 7 patients. The evaluation of the response to treat with liquid nitrogen, can you see the total patient repopulation in 24 patients, and no patient repopulation in 3 patients, because the patient had alopecia ophiacis and is a subtype that is often difficult to treat. And the adverse events is not frequently, and the mild intensity. For example, itching in 4 patients, burning and deterioration of the seborrheic dermatitis in 1 patient. And the conclusion, the response to treatment was favorable in the majority of subjects treated with cryotherapy, and adverse events were infrequent and of mild intensity. Now, there are some graphics evidence this patient is had a multifocal alopecia areata before the treatment, after the treatment, and 2 patients with focal alopecia areata before and after the treatment. And this patient, multifocal alopecia areata 2, before the treatment, after the treatment. Okay. Thank you very much for your attention. Thank you, Rowena, and the organization committee for everything. And any question, write to my email. Thank you very much.
Thank you very much, Doctor. Does anyone have any questions before the doctor leaves? Let's see the chat. Okay. Thank you. That was an excellent presentation, and I hope everyone has benefited by sharing your wonderful work.